Hello everyone. Thanks for joining me for this series of video vignettes on endometriosis. I thought we'd start by addressing one of the most important issues I think affecting the way that we care for patients with endometriosis. And that's getting back to the basics of what causes endometriosis. So let's start with what endometriosis is. Endometriosis is where the cells which line the inside uterine cavity and which are shed during the period are found outside the uterus, implanted on the lining of the pelvis called the peritoneum. I call it the wallpaper of the pelvis. So endometriosis is by definition outside the uterus. Well, how do we get there? Or what causes endometriosis, or how do the implants get outside the uterus? The most long-standing and still common theory today is the retrograde menstruation theory of Sampson, or the backflow theory, which states that when a woman is having her period, she's bleeding backwards through the tubes and those cells implant. That is not necessarily an unreasonable explanation of how endometriosis is caused, but it has a lot of problems and leads to a lot of myths, endomyths, that are perpetuated today. Let me explain. First off, endometriosis has been found before the very first period, and after the last period, and outside the pelvis, in the lungs, the brain, the back of the eye. In men, it's been found. So places where backflow cannot reach. So that's a problem for the theory. Also, we have a lot of discussions, we'll talk about it in future video vignettes about how we treat endometriosis. But whether you ablate or do ablation, try to burn the endometriosis, which is called ablation, or at surgery you try to cut it out, called excision, or you try to scramble it or fry it or whatever you want to do to it, if the theory were true and the woman was still having periods, then the implant should just come back or reseed with the very next cycle or subsequent cycles. So the rate of recurrence of endometriosis after surgery should be very high. But we and other centers have shown that after optimal treatment, optimal excision, or cutting out the actual disease and doing it well, the rate of recurrence can be very low. Perhaps most importantly, it makes people say things like, we've taken out the uterus, or we can cure your endo by cutting out the uterus because it's the source of endo, even if the ovaries are left in, which can stimulate the endometriosis. That is biologically, scientifically not true, that hysterectomy does anything to the endometriosis, which again is by definition outside the uterus. Can you have endo after hysterectomy? Absolutely. Or another common endomyth or belief is that you can treat endo with stopping periods, like inducing amenorrhea or no periods with the Mirena IUD or continuous birth control pills. So the idea is that they shut off the tap or stop the source of the endo, so the patient cannot have pain from endo when not having periods. Also, biologically, scientifically not true. So, meaning yes, you can have endometriosis even with no periods. So we have to correct this paradigm of the idea of where we or how we get endometriosis in the first place. Modern day theories include stem cell theories or metaplasia, where the cells just change where they're at. These are probably better theories and explain more of the observations of how we treat endo. So changing the paradigm on what causes endometriosis is critical. On this, I totally agree with Dr. Redwine. This is one of the most important things we have to do, because our understanding of how we get endo informs how we treat patients with endo. And women with endo deserve better. Thank you very much.